How often do you suffer from confusion, forgetfulness, and a lack of focus and mental clarity? Well, you could be one of the 6 in 10 people in Britain now suffering from brain fog on a daily basis since the COVID pandemic. Let's get more on that with our resident GP, Dr David Lloyd. Hello, Doc. It's always great to see you. Thanks for joining us. This seems to be a thing.
Yes, it is. It wasn't actually invented during COVID. The name started to appear about 2020, but yes, an awful lot more people seem to have it. And it encompasses, as you so rightly say, a lot of different symptoms, from forgetfulness, poor concentration, word finding, difficulty word finding, that thing I find. My favorite word, of course, is anhedonia, which is a lack of enjoying things. So it's a lot of different things. And luckily, again, because of this horrible disease, an awful lot of research has been done into it. So we now do have a medical model, a scientific model, if you like, for the damage that's been done by COVID, which causes these neuropsychiatric symptoms. I'm sure most of us who've had COVID will remember that profound loss of taste and smell. Well, that's actually a neuropsychiatric symptom and has been the clue to trying to understand what's going on in people's brains.
How does a brain fog impact on people's daily lives?
Well, it's an increasingly common condition I see in general practice. People are coming to me and they're using that term very specifically. And I find myself putting it on medical certificates and things now as well. So I think it's a very useful term to help people understand some of the things that they're going through, both internal and external. It's not just COVID. It is also the immense pressures that people are feeling under at the moment. And it's part of the sort of symptom complex of coping with such a stressful life.
Yeah, can you imagine having had COVID and also going through the menopause, the level of brain fog you have then? Anyway, that's another topic, Doctor, for another day.
Yes, please.
How can we reverse the impact of brain fog? What can we do?
Well, just sticking on the science, we think that there are new treatments that are going to come along, which will be very useful. There are actual medical treatments which will tackle the microglial cells in your brain. So we hope that there'll be some things there. But just like everything else, it is about exercising your brain, just like you'd exercise your body. So we know things like cognitive behavior therapy is very effective in this condition. And that is readily available in the NHS. So please, if you're ever at all worried and you've got this condition, call your GP. He can put you in contact with your local psychological therapy team. And it's a very effective treatment.
We tried to speak to you last week, Doc, but you were too busy looking after sick people. Yeah, quite rightly so. Can I just ask you quickly about what we were going to ask you about last week, and that is the contraceptive pill and whether how concerned we should be about it increasing the likelihood of breast cancer?
So it's my understanding that this is a very, very small risk, and you've got to balance that out against all the other benefits of being on oral contraceptives. One of the things that isn't mentioned very much, for instance, is that our contraceptive pill protects you against another evil cancer. We can all feel, all women can feel lumps in their breast at an early stage and get effective treatment. But ovarian cancer is a quiet, silent killer. And the pill absolutely reduces your risk massively of that much more difficult disease. So we've known for some time there is a small risk, and it is a very, very small risk. But the advantages of oral contraception hugely outweigh them. So I'm pleased if there's anybody out there thinking of stopping the pill because of this increased risk, please don't, because it really is a most effective form of contraception and the most effective way of staying healthy as a woman well into your late middle age.
Okay. For now, Doc, it's always a pleasure. Thank you.
Thank you. Thanks for having me.